Hello everyone and welcome back to our 2022 webinar series, A Bolder, Healthier Winter. This is where we're going to be covering a range of topics in 20-minute sessions, providing practical support to stay safe, well and warm this winter. Today we're going to be looking at eating well, where we'll cover healthy eating guidelines and how to access free and affordable food options around the city. This series is aimed at professionals and non-medically trained community leaders who have direct reach to the communities of Birmingham and those who have established and trusted relationships with their communities to help support their overall health and well-being. First, we're going to look at some of the benefits of healthy eating and how the different benefits may be more prioritised to some members of the community than others. So just a list of some of the benefits of eating well may include maintaining a healthy weight, preventing and managing chronic diseases, helping provide more energy, promoting a strong immune system, a strong skeleton, promoting heart and mental health, and even improving mood and sleep and muscle support. It's important to remember when you're discussing these healthy eating benefits with the community that some benefits are going to be more influential to others. So some may prioritise mental health, some may prioritise healthy weight. It's also important to consider what barriers are going to be faced to healthy eating, and we'll cover some of these barriers later in this webinar. It's also important to consider what they already know about healthy eating and what information would they benefit from knowing. One of the main things that comes up when we're talking about healthy eating and eating recommendations is the Eat Well Guide from the government, and it's based on 5 food groups that represent an overall healthy diet. We're going to be looking at getting 5 portions of fruit and vegetables a day. This could include 80 grams of fresh, canned or frozen fruit and vegetables, 30 grams of dried fruit, 150 millilitres of juice or a smoothie, noting that this only ever counts as 1 portion, 80 grams of beans and pulses, again noting that this only ever counts as 1 portion. Looking at basing meals on starchy carbohydrates like rice, pasta, potatoes, etc. Looking at getting a good amount of dairy or dairy alternatives, protein sources such as beans, pulses, fish, eggs, meat and other proteins, and looking at getting unsaturated oils and spreads and eating these in small amounts. To get all the vitamins and minerals we're going to need for a healthy diet, we need to make sure that we're promoting eating a mixture of foods and having a variety of colours of fruits and vegetables. The Eat Well Guide also talks about managing to drink 6 to 8 glasses of fluids a day and limiting red and processed meats. There's more information on the slides on the NHS Full Healthy Eating Guidelines. It's also important to consider how we can adapt this Eat Well Guide to make it appropriate for our audience. For example, making sure that it's culturally diverse and considers any dietary requirements that the person may have. There are some online adaptations that have already been made of this Eat Well Guide, such as a vegetarian and a Hindu version that is available online. However, when discussing this with the community, you can adapt it to the individual person's needs and tastes. When we're looking at understanding what a healthy food is, one of the key indicators that we can look at is the food labels when buying food from our supermarkets. They're going to have labels on the front of the pack which contain information on the energy or the calorie amount, the fat content and the saturated fat content, the sugar content and the salt content. And these are going to be labelled either red, amber or green colour-coded. And it's going to tell you whether that food contains a high, medium or low amount of that. Red generally means high, amber means medium, and green means low. So generally, the more green that's on a label, the healthier the choice is going to be. Now, it can be complicated sometimes because some foods that are higher in saturated fat, such as avocados and coconut, can be part of a healthy diet. So it's important to look at the NHS Food Scanner app as a good source of information to help understand which foods are healthy, what food swaps could be used, and what a good choice item is. Now, so to summarise the last 2 slides, we're going to play a short video from the British Nutrition Foundation's YouTube channel, and this will hopefully help to visualise the information that we've just discussed.
What is the Eat Well Guide? The Eat Well Guide is a tool used to define the government's advice on a healthy, balanced diet. It shows the proportions in which different groups of foods are needed in order to have a well-balanced and healthy diet. The Eat Well Guide does not necessarily represent the balance required at each meal. Rather, it represents the overall balance of a healthy diet over the day or longer. The Eat Well Guide is suitable for most people, but it does not apply to children under 2 years of age, or for some people with special dietary needs or medical conditions. Children from the age of 2 to 5 should gradually move to eating foods in the proportion shown on the Eat Well guide. It is important to choose a variety of different foods from each food group to help get a wide range of nutrients the body needs to stay healthy. What are the key messages? Eat at least 5 portions of a variety of fruit and vegetables every day. Base our meals on potatoes, bread, rice, pasta or other starchy foods, using higher fibre or whole grain versions where possible. Have some dairy or calcium fortified dairy alternatives such as soy drinks, using lower fat and lower sugar options. Eat some beans, pulses, fish, eggs, meat and other proteins, including 2 portions of sustainably sourced fish every week, one of which should be oily. Use unsaturated oils and spreads and eat in small amounts. Drink 6 to 8 cups or glasses of fluid a day, choosing lower sugar options. If foods high in fat, salt and or sugars are included in the diet, they should be consumed less often and in small amounts. We can use food labels to help us choose foods lower in fat, salt and sugars when shopping. Where colour-coded labels are used, pick products with more green and amber and fewer reds. So remember, the Eat Well guide describes the different types of foods and drinks we should consume, and in what proportions to have a healthy, balanced diet.
If you'd like more information on each section of the Eat Well guide, please also visit the British Nutrition Foundation's YouTube channel, where they have short 1 to 2 minute long video summaries on each segment of the Eat Well guide. Now that we understand roughly what a healthy diet looks like, it's important to consider some of the different barriers to healthy eating. I've put these into 3 separate categories, as this may help target the different approaches when talking about healthy eating. The first is fixed factors, and these are generally factors that can't be changed. Things like the low income, access to shops selling healthy food, time available to prepare food, and kitchen facilities. Then there's the knowledge section, which can be improved through education and information. And these cover barriers such as a lack of cooking knowledge or a confidence in the kitchen, a confusion around different food messages and food labeling, and an unawareness of what a healthy eating looks like. Finally, there are barriers related to food choices, and these are more about taste preferences and other dietary requirements, and especially how these can change and be diverse within a family unit or within a household unit that can make it more difficult to cook healthily. For example, if children or family don't like the healthy food, we can maybe suggest looking at promoting recipes that have hidden vegetables. Looking at some of the other solutions to some of the barriers, for example, if someone has limited kitchen facilities, we're going to be talking about sharing meal ideas that can be prepared in a microwave or without having to use any heating facilities at all. If low income is the barrier to eating healthily, this is where we'll look at signposting to food banks and pantries and other sources of affordable foods. At the minute, income is likely to be one of the more significant factors for many people that determines whether they eat well. And on the following slides, we're going to cover how to access some affordable eating options. One of the first ways that we can get free food in Birmingham is by using food banks. And these are going to be operated using a voucher referral system, which can be applied for on the Birmingham City Council website using the link in the slides. And once a voucher has been issued, a minimum of 3 days of food can be claimed. And these generally look at non-perishable food items. So this is things like pasta, rices, tinned foods like beans, meats, vegetables and fruits, tea and coffees, sugar, snacks and other cereals and foods such as that. One of the things to consider is food banks are generally open for 1 or 2 days a week, so always ensure that the opening days and times are checked before referring to a community member to a particular food bank to make sure that it is compatible with their work schedule or other commitments. There are also many other local services that are available around Birmingham which can help with more affordable food options. The first is the Active Wellbeing Society, which shows where you can access free meals at Big Feed community cafes across the city. Also, please note that some of these community cafes operate small food banks, such as the All Saints Church in Small Heath, so it's important to check the different facilities at the different cafes. There's also Food Cycle, which offer free meat-free meals across Birmingham, and this may be useful for those that choose a meat-free diet for personal, cultural or religious reasons. There is the Olio and the Too Good To Go apps, which offer free or reduced price surplus food from local organisations and chain restaurants. However, please note to use these, you have to have a smartphone that is compatible with app downloads, so make sure that that is appropriate for the community member that you are talking to. There is also the Incredible Surplus, who function on a pay-as-you-feel basis, where you can pay for food by cash, by time, as in voluntary, or skill at a time of collection or a later date. And also there are some local pantries which operate on a similar basis to food banks, but they require a small weekly fee of around about £4 for collection of food items worth about £15 to £20. Overall, there are loads of local services which can support with the cost of food. Please visit birmingham.gov.uk/food help for a really useful Google map showing the location of all of the relevant services in the local area. Also, we have the Healthy Start scheme. So if a person is 10 weeks pregnant or more, or have a child under 4 years old and receive certain benefits, they may be able to qualify for a Healthy Start card. The card has money on it and can be used in shops to buy plain liquid cow's milk, fresh, frozen and tinned fruit and vegetables, fresh, dried and tinned pulses, and infant formula milk based on cow's milk. And these cards can also be used to get free vitamins. If the qualifying recipient will get about £4.25 to £8.50 per week, and you can apply online via the NHS website or find out more information on the Birmingham City Council website using the link in the slides. There are also some other support that you can use to eat well on a budget. First and foremost, we have the warm welcome spaces. Birmingham City Council is working with the local community and a partnership of voluntary and community sector organisations to expand a network of warm spaces. These spaces will be available for people to use and visit during the winter period and beyond. There are several existing warm welcome spaces within the local communities across the city. These spaces are inclusive and non-judgmental. They're heated and free for all to access. The services at each space will vary, so please check online for a specific service, but they may include information on further support and available guidance, opportunities to participate in activities and to learn new things. They may have free internet access, computers and charging ports. They may have food banks, pantries and free refreshments, and they'll all have a friendly environment to connect with others in the community. More information on these warm welcome spaces can be found by following the link in the slides or by going to birmingham.gov.uk/warm welcome. I've also included links on the slide to some other budget resources, such as TV programmes like Eat Well for Less and Martin Lewis's Money Saving Expert, where you can gain useful tips and tricks to try and reduce the cost of food. In addition to eating well on a budget, it's really important to make sure that all eligible benefits are claimed using a benefit calculator like linked on the slides, as around £15 billion of benefits remain unclaimed each year that could be used to support the cost of food. There's also a link in the slides for an eligibility checker for free school meals for children up to the age of 19. And this will also automatically register the person checking for holidays, activities and food programme. Now, finally, we're going to look at some other national and local resources that can help with the cost of food and can also promote those eating well and healthy eating recipes. First and foremost, we have Cook the Commonwealth, which was an initiative launched by Birmingham City Council over the Commonwealth Games. There's over 750 recipes available from around the different Commonwealth countries, including recipes from dietitians across the UK, and these can be found on the Whisk app using the link in the slides. There are NHS resources such as Change for Life, where you can discover healthy swaps, recipes, nutritional advice, top tips and tricks, and a lot of family-based activities to stay healthy. Some of the other NHS resources include the Eat Well and Better Health resources to provide information on getting a healthy, balanced diet. Additional support to help with the rising cost of living can be found on the Birmingham City Council website. The support available is being constantly updated, so please make sure that the website is regularly checked for relevant support and guidance. For more information on the cost of living, either click the link in the slides or visit birmingham.gov.uk/helpingbrum. Alternatively, you can phone 0121 303 9944 for support from one of the community service team members. Now, the next step is understanding as a community leader what we would like your help with. As you are a trusted voice within your local network and you can help encourage healthier changes to the community's lifestyles, we encourage you to open up that conversation with your community. We also ask that you share the information within this webinar when you have these conversations. This can be done by signposting people to the relevant support or simply raising awareness of some of the information from this webinar. If you are enjoying these sessions and enjoy promoting positive health and supporting your community to improve their health and well-being and want to be more involved, you can support to be a Bolder Healthier champion. These Bolder Healthier champions are advocates for important health messages in Birmingham, and your role as a health champion would be to share information into your communities to encourage and support health and well-being. You could be supported through monthly themed webinars, through tailored resource packs and monthly drop-in sessions. If this is something that you're interested in, then sign up today by either searching Bolder Healthier Champions Birmingham City Council online or by clicking the link in the slide deck, which will be available on the Birmingham City Council website. Thank you for joining us today, and we'll see you for the next webinar.